So now let me tell you what the enzyme inducers will do and what the enzyme inhibitors will do. So what we have discussed about the enzyme inducers. Enzyme inducers are those particular chemical substances or those particular drugs which will induce the microsomal enzymes. Okay. Now you see here the enzyme inducers. Right, you take the enzyme inducers. Remember, enzyme inducers will increase the metabolism of other drug and thus their effect will decrease. Okay, so what the enzyme inducers will do? Enzyme inducers will stimulate the microsomal enzymes. Right, they will stimulate the microsomal enzymes. Now already I have given you the examples of those drugs which are the enzyme inducers. Alright. Now these enzyme inducers, they will stimulate the microsomal enzymes, and once the microsomal enzymes are activated, right, once they are activated, they will increase the metabolism, right, they will increase the metabolism of the other drugs. Right, they will increase the metabolism of the other drugs. Now, once the metabolism of the other drugs is increased, what will happen to the concentration of the drug? Thus, the concentration of the drug will be reduced, and as the time progresses, the effect of the drug will also reduce. Okay, so enzyme inducers will increase the metabolism of the other drug, and thus their effect will decrease, and thus their concentration and as well as the effect of the drug will reduce. So what I want to tell you here, enzyme inducers, they will decrease the efficacy of the drug. Now therefore, right, now this is an important point here. Therefore, whenever dose of such drugs, right, therefore dose of such drugs should be increased when administered along with the microsomal enzyme inducers. Okay, so now you are giving a drug, right, you are giving a drug, and along with that particular drug you are also giving an enzyme inducer, right. So you are giving a drug and along with that you are giving another drug which is an enzyme inducer, right, which is an enzyme inducer. Now what does this particular drug will do? This drug will induce microsomal enzyme, and this microsomal enzyme will increase the metabolism of the drug, and the effect of this particular drug will be decreased, right, the effect of this particular drug will be decreased. Now what I am trying to tell you here is, whenever you are giving a drug along with an enzyme inducer, what you have to do is you have to give increased concentration of the drug. So remember, therefore dose of such drugs should be increased when administered along with the microsomal enzyme inducers. Okay, so dose of the drug should be increased, right, the dose of the drug should be increased. Now which are the potent inducers of the microsomal enzymes, right? Now let me tell you which are the potent inducers. Alright, so already I have discussed, let me revise once again, right, which are the potent inducers of the microsomal enzymes. Remember, they include your rifampicin, right, rifampicin, which is a first line antitubercular drug. Then you have phenobarbital, right, then you have phenobarbital, then you have phenytoin, then you have griseofulvin, right, rifampicin, phenobarbital, phenytoin, and then you have griseofulvin, and then we have phenylbutazone, right, then you have phenylbutazone, and after this phenylbutazone we have what is called as the chloral hydrate, right, then we have what is called the chloral hydrate. So these are the potent inducers of the microsomal enzymes. Now let me tell you one more example. Remember, in case of the porphyrin synthesis, right? The rate limiting enzyme of the porphyrin synthesis is your delta amino levulinic acid synthase, and that is a microsomal enzyme. Alright. So the rate limiting enzyme of the porphyrin synthesis is delta amino levulinic acid synthase, which is a microsomal enzyme. Now when you are giving the enzyme inducers like your phenytoin or phenobarbital, they will induce that particular delta amino levulinic acid synthase and they will increase the porphyrin synthesis. Thus, these drugs are contraindicated in acute intermittent porphyria. Okay, so what I want to tell you here is, for porphyrin synthesis, right, I am trying to tell you one more example, right, for porphyrin synthesis, okay, which is the rate limiting enzyme. The rate limiting enzyme is your delta amino levulinic acid synthase. So delta ALA synthase, right, this is the rate limiting enzyme. Right, this is the rate limiting enzyme. Okay. Now enzyme inducers, and this is one of your microsomal enzyme, right, this delta amino levulinic acid synthase, this is one of the, right, this is one of the microsomal enzyme. Now what I want to tell you here is, the enzyme inducers, like for example you take phenytoin or you take the other drug that is phenobarbital, they will induce this delta amino levulinic acid synthase. Okay. So phenytoin and as well as the phenobarbital, right, phenytoin and phenobarbital, they will induce this microsomal enzyme, that is delta amino levulinic acid synthase. That means the activity of this particular enzyme will be increased. So once the activity of this particular enzyme is increased, what will happen? There will be increased porphyrin synthesis, right, there will be increased porphyrin synthesis. Alright. So what I want to tell you here is, thus these particular drugs, right, phenytoin and phenobarbital are contraindicated in case of acute intermittent porphyria. Okay. So these drugs, they are contraindicated in case of acute intermittent porphyria. Why? Because whenever you give these drugs, the activity of this enzyme is increased and the porphyrin synthesis increases. Already in acute intermittent porphyria, it is a disorder associated with the porphyrin synthesis, and again when you are giving these particular drugs, they will further increase the porphyrin synthesis and the individual will have increased abnormality associated with the porphyrins. So that is the reason why these drugs are contraindicated in patients with the acute intermittent porphyria. So summarizing about the enzyme inducers, remember, the enzyme inducers are those substances which will induce the microsomal enzyme, and they will increase the metabolism of the other drug, and thereby the concentration of that particular drug will be reduced and the effect of the drug will be reduced. So whenever you are giving an enzyme inducer, right, whenever you are giving a drug which is an enzyme inducer along with the other drug, right, along with the other drug. Now what this particular enzyme inducer will do, will increase the metabolism of this particular drug and will decrease the concentration of the drug. So what you have to do is, whenever you are giving this drug along with the enzyme inducer, the dose of the drug should be increased. And what are your potent enzyme inducers? They include rifampicin, phenobarbital, phenytoin, griseofulvin, phenylbutazone, and as well as chloral hydrate. Now you take the other example. Now for porphyrin synthesis, the rate limiting enzyme is delta amino levulinic acid synthase, and this delta amino levulinic acid synthase, this is one of the microsomal enzyme and this is a rate limiting enzyme. Now you give drugs like phenytoin and phenobarbital. So phenytoin and phenobarbital, these are the enzyme inducers, right, these are the enzyme inducers. So once they induce this enzyme, that is delta amino levulinic acid synthase, they will increase the porphyrin synthesis, right, they will increase the porphyrin synthesis. That is the reason why this particular phenytoin and phenobarbital, they are contraindicated in patients with the acute intermittent porphyria. Now, after having discussed about the enzyme inducers, let me talk about the enzyme inhibitors.